chair the Children's Cabinet, which has been an integral part of Maine in the past 7 years and will continue to be in the next year. What's said about Maine is that we are small enough to know each other but large enough to get the right things done. We tend to set focus and priorities and then follow through on implementation and policies.
I'm Brenda Harvey. I'm the Commissioner for the Department of Health and Human Services. I've been with Children's Cabinet as the Commissioner since 2006. I think it's also a small enough state that we know one another. Even before we were Cabinet members, our work intersected because we all had careers in our respective fields. And we came to the table with some essence of trust that we understood where the person was coming from, who was representing a particular sector we've been talking about.
We talk about the scope or the reach of Children's Cabinet. It really is the whole child through I should say that the whole spectrum of 0 to 24. You know, we look at the early years, the middle years, we look at high school graduation, college attrition, or career paths, work career paths. So we really try to look at the whole child through the generational needs as they grow.
Our responsibility at the Department of Labor is about helping people find good jobs. So probably prior to participation in the Children's Cabinet, I had been focused on older youth and adults, and working as part of the Children's Cabinet has really emphasized the importance of having an integrated strategy that includes the parents and the children.
I think that one of the values of the Children's Cabinet is being able to identify our common outcome measures and what we collectively think will measure how well we're doing individually as well as collaboratively.
When I attend meetings, national meetings around juvenile justice, we're able to lead, and Maine is able to lead in areas of recidivism measurement. We've taken a strong leadership in that area. And I think what the Children's Cabinet has brought to this is that a clear understanding that nothing happens in a vacuum. It all has precursors, and it all has subsequent implications.
In our system, we have been really trying to frame children's services and any development from a strengths-based approach. And we've also been trying to move our service system, the delivery system, all the nonprofits, to evidence-based services. But we would not have made the shifts that we have made had we not had the support and the understanding from the rest of the state agencies.
It isn't all about us doing our individual work better. It's how do we do the systems work. And so some of the work like the Maine Marks, which is developing a common set of indicators, or the integrated data sharing efforts that are being spearheaded by Commissioner Gendron. That's a lot of what we do as well, is where can we, the First Lady keeps saying over and over again, how do we add public value?
Particularly at times where money is tight, it's very easy to just hunker down and stay focused on whatever your particular crisis is. But because there are good relationships and a level of trust, it allows us to be more creative, to be willing to have conversations that you might not want to have if you didn't trust the person who was sitting across the table from you. And I think that really, without that kind of foundation, it would be very difficult to get creative, collaborative projects moving.
A specific example of that would be Educare, which is a quality early care and education center in Maine. Bringing such a facility to Maine would not have happened without the integral input of Commissioner Harvey from DHHS, our Health and Human Service component, and our Commissioner of Education, Sue Gendron.
I think the challenge is making sure that your umbrella is large enough to encompass those initiatives that support your priorities, and not so large that you get diffused. And I think that's been one of the things we've been very careful to do, is that we want to bring in those initiatives that are aligned and support our priorities. And by doing that, we give other people a stake, a voice in the process.
In our last legislative session, our department, because we oversee the Medicaid program, made some changes in Medicaid policy in order to be compliant with federal regulations. And they had a significant impact on the Department of Education, both funding and school services. And Commissioner Gendron and I both presented to the committees at individual times and at the same time, but our message was unscripted, but exactly the same. And they understood that and commented on it, how much it was clear that we had both vetted these policy implications and had planned for solutions together.
I'm Susan Gendron, and I'm Commissioner of the Department of Education in the state of Maine. We are looking at a comprehensive data system that will link across our agencies so that we are able to enhance the information that we will have, and at the same time use that to drive policies and decision-making and how do we serve families and children. Otherwise, you have competing measures. We will link with Health and Human Services. We'll be able to follow children from birth right through and transitioning into the labor force with the plan that we've put together.
A longitudinal database will allow us to protect the confidentiality of anyone's individual data, but also share aggregate outcomes.
I think having the Chief Justice as part of this, having the judicial system represented in terms of what we're doing for youth and families is really important.
My name is Lee Ingalls Softly. I am currently serving as Chief Justice for Maine's judicial branch. The connection to the Children's Cabinet has helped me help our trial judges understand what resources may be available for families, how those resources can be mobilized in a way that gets directly to families and uses the dollars best, and understand how the other systems in state government affect children's lives. It's actually hard to describe how effective it is to sit at a table with the commissioners and be able to say that this is the problem we're seeing on the ground with children and families today. Can we work together to solve this problem?
I call it a deliberative process in the sense that, we live in challenging times with challenging budgets. They're tough decisions that have to be made.
The focus is, what are we trying to do? How can we all pool things to come to the best outcome? And it doesn't mean we always agree, because we don't. But there is that respect and value and a recognition that people are focused on doing their job to the very best of their ability.